Why is the fourth dose necessary and who qualifies for this?
Well, right now, what the data is showing is this Omicron variant, as we all know, is very infectious. Right now, it's unprecedented how high the infection rates are in the United States. And with such a high infection rate, there's a higher probability that individuals that are severely immunocompromised will get infected. Now, these are individuals that may have some forms of cancer on certain medications, such as chemotherapy, individuals with severe uncontrolled HIV, and other genetic immunodeficiency disorders, where it's been proven through the data that if they get their vaccinations, there's less of a chance that they can mount a strong immune response, building those antibodies. So what the CDC and the other scientists are looking at is the fact that getting that extra vaccination will give them a little more of an opportunity to produce that protection that they really need.
Well, as for the immunocompromised, with Dr. Quinn, do you see a fourth dose becoming necessary for everybody?
Well, right now, that's a debate that's going on in the scientific community, and a lot of this will depend on what the data shows. What they're looking at is how long we sustain a strong enough immune response after we get vaccinated. Now, it's been shown that after we get our 2 doses of Pfizer or Moderna, or after we get our 1 dose of Johnson & Johnson, we had a certain level of protection of antibodies. But over time, when they studied individuals, they saw that rate went down, making them more vulnerable. That's why we're doing the booster. But now what we have to do is continue to follow these individuals that are getting these boosters and just see how long we can sustain a high enough antibody level so that we'll be protected. So this is information that's yet to come, but we just have to just be patient and just continue to trust the science.
Dr. Quinn, the news comes just after new information came out about the COVID risk for diabetics. I want you to tell us about that, but also the fact that children really that have had COVID need to be checked for diabetes. They have more of a chance, I understand, of getting that disease.
Well, what's going on is I did a story on that yesterday with your network. And basically what's being discovered is when people contract coronavirus, the COVID-19 virus, it's attracted to those angiotensin receptors on the cells that are very, very prevalent in our respiratory system. That's why we have the respiratory complications, but also the beta cells of the pancreas where the insulin is produced. And once the person has a really severe infection, then the pancreas suffers and some of those cells are injured and the person is not producing insulin enough. This leads to hyperglycemia, resulting in that person developing diabetes. And this is very prevalent in children, unfortunately. The CDC put out a really big report on this past Friday noting that, but also note during the pandemic, a lot of people are pre-diabetic. 1 in 5 children are considered pre-diabetic, meaning they don't have diabetes, but they're right there on the edge. And because of the weight gain associated with the pandemic, a lot of people have transitioned into diabetes. So these are just 2 factors. And then in this report from the CDC, they noted a lot of people were put on steroids in the hospital, leading to hyperglycemia, diabetes, and then just the inflammatory process of the coronavirus infection causing people to have diabetes. So we really have to follow this and understand that everybody needs to get vaccinated. We need to do everything we can to cut down on infections because as time goes on, we're learning of more complications of this coronavirus.
Wow. All right. Dr. Timothy Quinn with Quinn Health Center, thank you so much for being with us.
Hey, thank you for having me.